There are certain stroke symptoms that, if you experience them, you need to be aware that it's time to call 911 right away. Because if you don't, you could be in trouble. So make sure you stick around so you don't miss anything. I'm a doctor. Here are the key stroke symptoms every senior must be aware of. If you or your loved one are over the age of 65, did you know that your risk for having a stroke doubles every 10 years after the age of 65? And the scary part is that many strokes are preventable. In fact, 1/3 of strokes occur in people who have atrial fibrillation, which we can control with the right treatment. But this only applies if you catch it in time. That's why it's important to learn about the warning signs and symptoms of stroke. And there are 7 symptoms that are especially common in people over the age of 65. Number 1, sudden numbness or weakness in the arms or legs, especially on one side of the body. Do you know what's the medical term for this? It's called hemiparesis. Hemi means one side, and paresis means weakness. So when you have a stroke, you usually have weakness on one side of the body, because the stroke affects one side of the brain, which then controls the opposite side of the body. For example, if you have a stroke in the left side of the brain, you will notice the weakness on the right side of the body. The same is true for numbness. If you notice any numbness or weakness on one side of your body, it's very important to seek medical attention right away. No. 2, sudden confusion, trouble speaking or understanding speech. You may not realize it, but our ability to speak and understand others requires a lot of brain power. In fact, just talking uses 10% of your brain power. So when you see someone talking, they don't look like they're doing much, but that is actually a lot of work for the brain. That's why when we have a stroke in an area of the brain that controls language, it can cause big problems with speaking and understanding speech. So if you or a loved one experiences this symptom, you need to get help fast. No. 3, sudden trouble seeing in one or both eyes. Did you know that a stroke is the 3rd leading cause of vision loss in people over the age of 65? A study done by the American Academy of Ophthalmology found that nearly 14% of people who had a stroke ended up losing their vision because of the stroke. This means that if you have a stroke, there's a chance you might lose your vision, at least in part, unless you get help in time. So if you notice any sudden trouble seeing in one or both eyes, especially when it's accompanied by other stroke symptoms like numbness or weakness on one side of the body, you should seek emergency help right away. No. For sudden dizziness, loss of balance, difficulty walking. Dizziness and loss of balance are 2 of the most common symptoms of a stroke. They happen because the part of the brain that coordinates movement and balance has been affected by the stroke. So if you suddenly feel dizzy or off balance, it could be a sign of a stroke. It's also important to pay attention to how you walk. If you start walking funny or taking small steps, this could also be a sign of a stroke. This is because when you walk, there's a rhythm to it. Your feet take a certain pattern while moving forward, and if you have a stroke, this rhythm can be affected, causing you to walk in a strange way. No. 5. Sudden severe headache with no known cause. Headaches are not always a sign of a stroke, but when they come out of nowhere and are really bad, they could be something serious. If you have a headache that's different from your usual headaches, especially when it's severe and doesn't go away, it could be a sign of a stroke. This is because a stroke can cause a lot of pressure in the brain, resulting in a headache. Keep in mind that this is more common in men than women. So if you're a woman who gets migraines, you might just be having a migraine. However, if you're a man who has never had migraines before and you get a severe headache that comes out of nowhere, it could be a stroke. No. 6. Sudden difficulty with coordination. Did you know that your brain has special cells called the cerebellum that helps with coordination and balance? So when you have a stroke in this area, it can affect your coordination and make it difficult to do things that require precise movements. So if you suddenly find yourself dropping things, stumbling, or having trouble buttoning your shirt, it could be a sign of a stroke. And no. 7. Sudden trouble with memory, thinking, or reasoning. You might be wondering how this could be a sign of a stroke. After all, we tend to forget things from time to time. But when it comes to a stroke, there's a big difference between forgetting things and being unable to remember things. When you have a stroke in the area of the brain that controls memory and thinking, it can affect your ability to remember recent events, think clearly, or make decisions. So, if you suddenly find yourself unable to remember where you are or what you are doing, this could be a sign of a stroke. It's important to note that this is different from normal forgetfulness. If you're concerned about your memory, it's important to talk to your doctor. So, if you or a loved one experience any of these symptoms, it's important to seek medical attention right away. Remember, time is brain. Every minute that passes during a stroke, approximately 1.9 million brain cells die. That's why it's important to get help as fast as possible. Now, here's what you need to know about calling 911. Calling 911 is critical in a stroke emergency. The sooner you call, the sooner emergency medical services can transport you to the nearest hospital where you can receive treatment. Don't try to drive yourself to the hospital. EMS personnel are trained to recognize the signs and symptoms of a stroke and can begin treatment en route to the hospital. They can also help stabilize your condition and prevent further injury. Additionally, EMS providers can alert the receiving facility that a stroke patient is on the way, allowing the medical team to prepare for your arrival. This can expedite your treatment and potentially save your life. In conclusion, knowing the warning signs and symptoms of stroke is crucial for anyone, particularly for seniors over the age of 65. By familiarizing yourself with these signs, you can be better prepared to respond quickly and effectively if you or someone you know experiences a stroke. Remember, acting fast can make a significant difference in the outcome of a stroke. So if you suspect someone is having a stroke, don't hesitate to call 911. Stay vigilant, stay informed, and prioritize your health and well-being. Thank you for watching. I hope you enjoyed this video. If you liked this video, please give it a thumbs up. And don't forget to subscribe. Thanks for watching.